I am so happy to have with me today Lisa Arnold, who is a stroke program coordinator for, I believe, Providence St. John's Health Center in Los Angeles or
Santa Monica.
Santa Monica. Well, close enough. Close enough. And she's here to speak about secondary stroke, but I've asked her to do a little bit of an introduction. So if she can do an introduction, and then we're going to talk about secondary stroke and some knowledge that she has in her position. So Lisa, you want to take it away?
Hi, everyone. Good afternoon. It's a sincere pleasure to be with you this afternoon and early evening where you're coming from. As Marylee mentioned, I'm the stroke program coordinator at Providence St. John's Hospital in Santa Monica. It's considered a comprehensive stroke center, which means we can handle the highest level of care and complex neurological cases. I've been a nurse for just about 10 years, and my background is in emergency room medicine. And I pursued a role as stroke coordinator about a year and a half ago. I lost a very close family member to stroke several years ago before we had the treatment that we have today for secondary stroke prevention, as well as acute management of stroke. So it's a true passion of mine.
Excellent, excellent. Well, thank you for that. She and I've talked several times and emailed, and I didn't know all of that about her. So what we're going to focus on today is secondary stroke prevention, and there are so many, as you all know, there are so many things that play into stroke in the first place, and then also play into secondary stroke. We're going to talk a little more in depth about the AFib link with secondary stroke, but what are, I guess in the medical community, what is kind of a definition of secondary stroke? What are maybe some basic things once someone has had a stroke and is in kind of that recovery phase to be aware of, whether it's AFib or not AFib, and then we're going to kind of dive into some things about AFib or atrial fibrillation.
Sure. So when we talk about why it's important to reduce our risk of secondary stroke, Marylee, every year there's 800,000 episodes of stroke a year. And 23% of those, or 1 in 4 people, will have another stroke within 5 years following their first stroke. And when we break stroke up, just briefly for everyone's education, 87% of those strokes are what we call ischemic. So that's that lack of blood flow in the brain. And then 13% of those is what we refer to as hemorrhagic, which is a bleeding in the brain. I like to refer to it as plumbing. One is a clog in your pipe, in your kitchen sink pipe, and the other one is when a pipe bursts. And today, stroke is still the 5th leading cause of death and the leading cause of disability in the United States. So that's why it's so important that we address those secondary risk measures. So when we talk about looking at why stroke survivors can reduce their risk of secondary stroke, we're talking about your vascular risks, such as high blood pressure. So optimally, based on new guidelines came out last year with the American Heart Association and secondary stroke prevention, ideally people's blood pressure should be around 130/80. The guidance of their physician, managing their medications, and making sure that they're also adding adjunctive therapies such as diet, lifestyle modifications. Managing your weight is a big one. Obesity is another major risk factor for having strokes. And certainly during COVID, a lot of people led a more sedentary lifestyle than they normally would have, increased their weight, which then caused an increase in high blood pressure, an increase in your diabetes management, resulting in a stroke. So from the world of stroke, last year is definitely an interesting year. A lot of people coming in with what I refer to non-compliance with their lifestyle and their medications. So when I talk about managing those risk factors, controlling your cholesterol is another one. And you'll kind of see a commonality. They all go back to somewhat managing your lifestyle, healthy eating, managing a Mediterranean diet. I think it's great that you have a cooking show coming up, influencing people to make sure that they're monitoring what they eat and get moving. If you've had a stroke and it's not a very disabling stroke and you have the opportunity to get out and exercise, get out and get moving every day. 10 minutes at a time is great. If you need a little bit of assistance, working with physical therapy or finding an exercise program that works for you is really important to help preventing another stroke.
I think one of the good things that came out of COVID is the number of YouTube exercise videos and things that are available for people. I think the thing for me has been looking, particularly in the winter, because we have winter here in Illinois, is finding the one that works for you. So the first one might not be for you, finding the ones that work for you and then flagging them so that you can go back to them. But that's one good thing that has come out of it, is a lot of people have put things on YouTube and made them accessible for us in our homes.
Yep, COVID certainly transformed the way that we can live our lives if we open ourselves up to them. And like I said, it's managing diet and physical activity that suits your lifestyle and any possible disability that you have from a stroke. But really working on those modifications will help, coupled with maybe a medicinal management. So if you have high blood pressure, you may be reducing your salt intake and managing your diet, as well as being on a medication. And as you find a healthy balance between the two, some people end up getting off of their medication. Same with diabetes. When we look at diabetes, that increased a lot last year as well. People were starting to cook at home, or for those people that can't cook, we're relying on takeout food, which, as we know, is high in fat, high in sugar, high in sodium. So optimally, we want to see those A1C levels less than 7. So for those of you that have diabetes, you really want to make sure you're doing those check-ins with your provider, checking your A1C. And if your A1C is still high and you're already on a medication such as metformin, there's new medications out there that your doctor might suggest to put you on as well. So lots of new things out there in the world of stroke, particularly that came out last year, to really help with those secondary risk factors. And then obviously some people still smoke. If you're smoking, do your best to quit smoking and make your alcohol intake. The average drink, is usually, they recommend 1 a day for a woman and two a day for a man. And obviously during COVID, we certainly saw an uptick in drinking for people as it results to stress. So there's a lot out there, and I think those are some of the important take-home messages for everyone is really working with your healthcare provider to manage those risk factors.
Yeah, ask the questions. Ask the questions and listen to the answers. Great.
Yeah.
Mm-hmm.
So I think you wanted me to touch a little bit on AFib.
Yes, that's the thing that we wanted, and I'll tell just a very brief story that some of you may have heard before. Is the number of people that I met at the camps in the early years, especially before we had many hospital sponsors and things, the people would say nobody knew why they had the stroke. It was like they were baffled. Much of this was 12-15 years ago, and we're way further along now than we were back then with AFib and all of those things. But it was very discouraging and disappointing for people, and fearful for their future if they had no reason. If you're diabetic and you're overweight and you have high blood pressure, you got something to work with. My husband had blocked carotids. He had carotid endarterectomies. We took a deep breath. So putting together the information. So what we want to talk about today is AFib and preventing secondary stroke for those that have AFib. So you can talk a little bit about what that is and how important it is to take the efforts.
So when we look at AFib, we're talking about the different chambers of our heart. So we're looking at our atrium, and we're looking at the rhythm and how it works with the ventricle. And they're not working together, which results in an irregular heartbeat, and then we have a blood clot that breaks off and travels to our brain. People that have AFib are 5 times more likely to end up having a big ischemic stroke. That's why atrial fibrillation is so important. Atrial fibrillation can also be silent, meaning a lot of people don't know that they have atrial fibrillation. It can last for a period of 5 seconds, up to 30 seconds or longer. So sometimes people don't even realize that they have atrial fibrillation until they have a stroke. So that area that you're talking about, Marylee, where people don't know why they didn't have a stroke, we call that a cryptogenic stroke.
Correct.
Cryptogenic stroke is when we've done all of the tests. We've looked at your platelets. We've looked at your clotting times. We've tested your heart. We've done MRIs and CTs and CAT scans. And we've done all the other things that we normally do when we do a stroke workup on a patient. And we still can't find the cause. So a common thing that's happened and actually has become very popular in the past couple of years is doing cardiac monitoring. So they'll do an implantable cardiac monitor. So a company like Medtronic, and I don't work for Medtronic, has developed a device, a very non-invasive device, after looking at different trials, such as the Crystal F trial, where this very small device that's smaller than about a AAA battery is non-invasively implanted underneath your rib cage. It gives patients peace of mind, and it also typically results in the diagnosis in about 30% of cryptogenic strokes end up being atrial fibrillation. The reason why this is so important is because historically these monitors were on the external part of your chest. They were bulky, they were hard to read, and there was lack of compliance from patients wanting to wear them, and the results of them were not favorable. So a patient might wear it for a week and then end up having another episode of AFib, but it wasn't recorded. The new devices that are out there today have a much longer lifespan. They can last up to 3 years. And some patients decide to keep them in for peace of mind, knowing that they're monitoring their heart that will detect AFib. The average person wearing these devices, it takes about 85, 86 days for the first detection of AFib. That's why it's really important for patients to work with their multidisciplinary team and their cardiologist to consider long-term management of having these devices in. Another thing is the devices that are there today are also compatible with MRI. So I have a family member that has one and can't have an MRI unless he goes to a very specific MRI machine further away from his home. So the newer devices today are MRI compatible, which is great, allowing us to still manage patients accordingly. And then ultimately 90% of patients.
Oh, we lost your sound, Lisa.
Did you have a question, Marylee?
We lost your sound. I lost your sound for just a moment.
Ah, sorry. I think
No, you're back.
I was
You're fine. You're fine. Well, yeah. The thing that pops up in my mind is, and I touched base with you, Lisa, on this informally, and that is everyone doesn't have access to the health care that we have access to here in Central Illinois and what you have in the greater LA area. So what would be, I guess, a good question for, I mean, some folks don't even have a neurologist. They're referred fairly quickly, they're referred back to their family physician. So what words or phrases or what questions would you say a person could pose to their physician or their neurologist if they haven't had an assessment for AFib and they had a cryptogenic stroke? Does that question make sense?
It does. So the most important thing, and obviously here in Los Angeles, we have an overwhelming amount of resources. It's a very competitive, robust healthcare community. In other areas of the country, I do agree with you. It's important to have those conversations, asking your multidisciplinary team or your primary care physician, hey, I had a cryptogenic stroke. Have you figured out what we're going to do to determine what the cause of it is? How do I know that? How do I know if it was caused by atrial fibrillation? Sometimes it runs in your family as well. So it's important to say, I have a father, a mother that had atrial fibrillation. And then asking them if I need to follow up with a cardiologist as well. So it's that multidisciplinary approach and advocating for yourself. So they should be addressing things like, yes, maybe it was the cause of AFib, and let's consider the monitoring devices that are available. And obviously Medtronic is an internationally recognized company, and these providers should be fully aware of the services that they offer.
So a cardiologist, does it require a special physician to implant it, or do cardiologists talk about who does the implant if you get that far?
Usually cardiology would be doing it, but it's, for instance, at my hospital, we tend to do it on an outpatient basis. You might get a stroke and say you're getting discharged, they might end up doing it on an outpatient basis. We actually do it in a small portion of our GI lab in the hospital. That's how non-invasive it is. Okay. And then patients go home, there's a very small incision made, and they have peace of mind. And sometimes people end up having a syncopal episode, which was a result of AFib, and they didn't realize that. So this will detect those types of episodes, and the efficacy is proven to result, as I said, in about 30% of these patients that have a cryptogenic stroke have AFib. And then you'll get put on your anticoagulation medication and monitored away.
Very interesting. Very interesting. Yeah. If anybody watching has a question, you can type it in, and I would be more than happy to have Lisa answer that. So if I find out I have a cryptogenic stroke and is typically the referral and the process for AFib down the road a little ways? Should that start right away?
It should start right.
Yeah, timeline. I guess timeline's what I'm asking.
It should. If you're in the hospital, they'll start looking at that while you're in the hospital. So they'll start working with your. I had a patient recently that had one put in, and it's a discussion. Is having those conversations and asking those questions.
Okay.
And it's usually started in the hospital, and then it might end on an outpatient basis. But you don't want to wait, because like I said, AFib can happen for 5 seconds, 30 seconds. The trial with Medtronic looked at a duration of 30 seconds or longer, and then an extended period of time. So the likelihood of AFib being the cause of your cryptogenic stroke increased the longer you had the device in. So it's about, I think, 85 days was the average detectable time frame for people. So it's not something where you can expect, unfortunately, that you might get the answer tomorrow. It might take a week, it might take a couple of weeks, it might take a year. I think that's one of the advantages of the newer devices that we have out there, is that you can have that reassurance that it will hopefully be detected if it is AFib.
I have a question, and this is elementary, because you talked about the different chambers of the heart.
Sure.
And can you tell us about the blood pooling and what actually happens when that cryptogenic stroke happens? I think it helps if we have a visual of what might be going on in my heart when I had that stroke.
So I don't have a picture of the heart. So what happens, blood pools in your upper chamber of the heart. So you have your atrium up here and you have your ventricle down here. Yeah, exactly. So top's your atrium and the bottom's your ventricle. And they're not talking. They're not talking correctly. So your blood pools and it forms a clot, which breaks off. So it's an irregular heartbeat. That's typically what most people understand it as.
So the clot breaks off in the heart
and
moves and travels up a vessel and causes the stroke.
Usually through your large arteries here, which are your carotid arteries. And then sometimes atrial fibrillation is a result of what we call a large vessel stroke. So you have those larger arteries in your brain, and those ones are when those larger arteries are blocked, those tend to result in your strokes that have aphasia, left-sided weakness, or one side of the body is completely paralyzed. Mm-hmm. Versus when we talk about strokes that result from a vascular issue like high blood pressure, diabetes, we tend to call those lacunar strokes. Those are smaller vessel strokes.
Right. Mm-hmm.
But AFib is what we call a cardioembolic stroke in nature. Okay. It can result in those larger, massive strokes.
Excellent. Excellent. Wow. Lots of good information. Lots of good information. Anything else that you think of that you would like to share with our audience? This video we'll put it on our YouTube channel, and it will also be available on our website and our social media for months and months. So hopefully people will be watching it who didn't catch it right now. But
I think
anything else?
You'll see my sign behind me, my Be Fast sign. I think that one of the greatest lessons I've learned last year, and one of the things I really learned about healthcare and how COVID changed healthcare, is please don't be afraid. Please listen to your body. I am here to help you. Doctors are here to help you. Your providers want to hear from you. They do not want you to stay home. They want you to be compliant with your medication. So if you've run out of medication, if you have AFib and you've run out of your anticoagulation medication, or it's disagreeing with you, let your doctor know. And if you've had a stroke and think you're having,
we've lost your audio again. We lost all that audio.
Sorry. I was saying, you know, don't delay going to the hospital and making that phone call to your provider. You need to utilize your EMS resources, your frontline resources, because if you wait, we can't give you the optimal treatment that you need, especially for secondary stroke. There's the most amazing complex neurological therapies out there and drugs to manage stroke. And it's unfortunate that last year, a lot of people were just afraid to reach out to their doctor, either because they were afraid to go to the hospital, or they thought they were being a burden to the hospital system. And as a result, a lot of people ended up with a severely disabling stroke.
Yeah. My husband, we're coming up on the 20th anniversary of his stroke. And I am just blown away by the amount of information and the vast, I can't even think of the right word, but the resources that are out there for acute or for rehabilitation and ongoing therapies and ongoing ways for people to cope and to learn to live with stroke. Because once you've had that event, it's life-changing. We're not going to argue otherwise from that. It's life-changing, but there are ways to cope with it. But we just have to keep looking for those, seeking those out, pulling out those nuggets that work for you.
Mm-hmm. And I also think that support groups such as yours, Marylee, and resources are so advantageous. The last decade in the world of stroke is, to me, just amazing to go back and look at it retrospectively, how it's changed, and it's allowing to change the lives of others with people like yourself that are getting out there and spreading the word. It's really a community involvement. It's a collaboration between yourself, community. We are all educators at the end of the day. As you've said, your husband had a stroke, so you're aware of the importance of educating others, knowing the signs and symptoms of stroke. And even young children are like a sponge, and they even can recognize signs and symptoms of a stroke if you explain it to them. So that's another huge take home for me. We're all educators, and to make sure you're educating friends and family on recognizing a stroke and how to prevent it.
Absolutely. Yeah, recognizing it and then gathering information for like cryptogenic stroke and for the things that we learn beyond just that acute moment when we've had our stroke. I don't see any questions coming through. Anything else on your list of thoughts?
Anything else today other than what I talked about? And if you haven't seen your doctor in the past couple of months, check in with them. Get a good healthy checkup, check your blood pressure, check your cholesterol levels. If you're diabetic, check your A1C, and make sure you watch Marylee's cooking class. I'm going to probably try to see.
Oh dear, now I'm going to have to really be sure it's healthy. Actually, I've been coming across a lot of good ones.
Yeah.
Well,
Yeah. And you have my contact information, so most certainly anyone's allowed to email me if they ever have a question that wasn't answered today or something comes up after this.
Yeah, and I think most everybody knows how to reach out to me, and I know how to reach Lisa. And I really hope that with our monthly support groups that we have once a month, I'm hoping to invite Lisa back for maybe a time when she can just join in and we can just all look at each other's faces and just have a discussion. Because I think even if you've had a stroke and it's been 6 months or 20 years, we just cannot let go of knowing what's out there, what we can do to improve our quality of life. So important.
I agree, and I want to attend camp someday with all of you.
I want you to. Hey, bring us out to LA.
Like
Come on.
You and partner with you in getting a stroke camp out here in LA. I think it would be amazing. So
that would be absolutely amazing. We would love it.
To come.
We would love it. So,
well,
all right. Well, Lisa, thank you so much for your time.
Pleasure.
I know she's given up time. She's a busy woman, and I really just appreciate connecting with you and all that you've done. And I hope those of you that are watching will tune in later on this month when we have our list of things that we'll be posting, that calendar of things we've got going on. But maybe I'll see some of you a week from Wednesday, the 8th, to cook a little bit with Marylee.
Well, thank you.
Bye now. Thanks.
Bye now. Bye.